Tonight, we're talking to Boston's medical experts for insight into the coronavirus pandemic. And we're joined now by Dr. Sharon Wright with Beth Israel Deaconess Medical Center. Thank you for being with us once again. So we just came off a weekend, really nice weather, clear people are not staying at home. We did see a lot of people not wearing masks, not social distancing. What is the risk with that? And what's at stake when the governor is trying to plan reopening?
I think we're all starting to feel good as the numbers start to come down a little bit, but I think what we're seeing is what is really a sign of success. We were expecting to hopefully flatten the curve, and we did, but we're still going to be here for a little while. So it's important for now and when things start to reopen that people not be in too many people in a group, and that we keep social distancing, especially with people outside of our own household, so that we can continue to see an improvement. It's nice outside. We all want to get out. We've been cooped up for weeks, so totally understandable and probably better in the fresh air, but still something to watch out for.
So talking about reopening, New Hampshire, Maine, they have reopened to a degree. What's your advice for people who might be thinking about a trip, maybe just to get away or maybe to go shopping, get a haircut?
I think we want to be careful because Massachusetts is still one of the states with the highest rates of coronavirus. Even though our numbers are getting better, they're not gone. And so you don't want to be traveling to a state with less cases where you might inadvertently be bringing it with you. So you want to make sure that you're still wearing some sort of face covering and that you're social distancing. And I would really try to follow the governor's requests and wait until things start to open up here before we go out too much.
Yeah, be cautious. All right, so the FDA stepped up scrutiny of the antibody test today. It's requiring test makers to apply for that emergency use authorization. Should we be concerned moving forward about the accuracy of these tests? And what about the people who may have already had one?
So these emergency use agreements are really important because they help test makers start to get them out faster, because we do need them. But unfortunately, they don't do any kind of confirmation of accuracy. And so it's just not that type of FDA approval. And so, it depends on each type of test, which detects a different part of the virus, how accurate they are. I wouldn't be too worried. Remember, this is a test that just tells you if you've been exposed to it in the past, not necessarily whether you have a current infection or not. And so we don't even know if it gives you long-term immunity. And so right now, these are really best as public health tests and in other certain situations, or as recommended by your doctor in specific cases. And so I wouldn't be too worried if you had one already, since we don't really know what to do with it yet.
All right, good advice. Dr. Wright, thank you so much. We appreciate your time.
Thank you.
All right.